So this month we're going to be doing our annual compliance training. This is a training that we do every year and that you would have gotten at Hire that is part of our compliance program. So a brief history and introduction. A number of different state and federal agencies have developed programs for monitoring and decreasing the potential of fraud, waste, and abuse. A compliance program is a way to reduce that risk within our agency by providing education and communication between all of our staff, employees, and supervisors. Compliance programs provide adherence to the federal, state, and private health plan regulations or requirements. There's a number of steps that go into creating this plan, such as assessing risk, going through different legal strategies, looking at accounting, clinical practices, and policies. Our compliance program is built around our agency, and annually we review this policy with all of our employees as well as at Hire so that they understand that we follow specific standards and policies and procedures, and they also agree to continue to follow those themselves. At Hire, all of our employees are searched on the OIG list with the state and federal government. We also provide annual trainings and a training at Hire as well as a compliance pledge to make sure that all of our employees are agreeing to comply by our compliance program. Agencies will consistently enforce the standards of conduct through appropriate disciplinary actions. This includes violation of any of our compliance program rules as well as failures to notify us of any other violations that may be going on. Basic rule to follow when you are looking at compliance is when in doubt, you should always ask. The law can be complicated, and compliance includes not only our agency's standards and procedures, but it also includes all of the federal laws, contracts that have been signed, anything that has to do with working with Medicare or Medicaid, anything that has to do with working with the government. So there's a lot that goes into this as far as following a compliance program, but also making sure that you're in compliance. So if you have any doubts at all, you should be reaching out to your supervisor, reaching out to the agency, and letting them know that you have a question or that you are wondering if this would violate anything in the compliance program. So a compliance program involves everyone, all staff members, all managers. Obviously, no one can have eyes everywhere, and the ability to prevent any wrongful conduct has to do with everyone working together and reporting things when they see it. You can't get in trouble for having a good faith report, and that means that if you honestly believe that something might be going on, you should report, even if you just have a question of whether this is wrong or not. A bad faith report is reporting someone that you know is not doing anything wrong out of spite or just to be, cruel or mean. But if you have a good faith report, you should always report, even if you are in doubt of whether it's accurate or not. So one of the things we agree to is to comply with all laws. This has to do with any laws, regulations, rules, federal or state, as an agency. And since you're working for this agency, you would also agree to that as an employee, that you would not violate any laws or rules or regulations while employed here under exceptional home care. So this is just a few of the policies within our policies and procedures book that is included in our compliance program. Providing an equal opportunity to work, making sure that we do not violate any OSHA guidelines, providing a safe place for people to work, as well as providing a place where people don't get discriminated against at Hire off of race or sex. We also make sure that we're providing an accurate pay schedule that is part of the compliance for compensation, making sure you're providing a schedule to everyone and that you're letting them know if there's changes in that schedule so that they can prepare themselves. This is not the entire list, but it just gives you an idea of some of the policies that are in our policies and procedures book that have to do with our compliance program. So the False Claims Act is a federal law that imposes liability on persons or companies who defraud the government programs. This law has been around for over 100 years, and basically for healthcare organizations like us and home care organizations, it prevents us from defrauding them in any way as far as billing services. It means that we are always going to, under our compliance program and our agency, make sure that the things that we're billing we believe are accurate and exactly what happened. It means that the services that we put down on any bills, the times that we put down on our bills, we will always strive to make sure that they are correct and what we truly believe happened with our clients and in their homes. Another thing you have to be concerned with compliance is how you grow your business. When we're getting referrals, when we are looking into getting more clients, there are certain ways that we can market and there are certain ways that we can't. One of the ways that you do not want to market is any way that is going to be looked at as some sort of kickback. It means that you don't want to pay other medical providers like doctors for clients that may or may not need your services. You also don't want to pay clients directly for bringing their services to you. You only want to provide services that are needed. And to do that, you want to make sure that there's no exchange of funds that could be considered fraudulent in any sort of way. So we don't pay for clients, we don't pay for referrals. And as caregivers, you shouldn't either. You should never exchange money with your clients in order to stay their caregiver or provide them something outside of the care that is on their care plan. So EVV with our agency is obviously a big one. We do a lot of electronic visit verification here. So with our contract with Texas Medicaid, we ensure that our EVV is going to be accurate and reliable. That means that we will not enter in time that we know not to be true, that we'll make sure that the time is correct, that we will make sure that we're only putting in time and confirming time that we know services were provided. As a caregiver, you are supposed to make sure that your time is accurate, whether it is on paper or electronic, which means that you only clock in when you start services and that you clock out immediately as soon as your services are done. This is part of the agreement that you sign with our agency and that we continue to sign with the state of Texas, making sure that those hours that we are billing are correct and accurate at all times. Clients' rights is also something that we consider when we're looking at compliance. We have to make sure that we are taking into account our clients' rights at all times. We have to make sure that we do not violate their rights when we are providing care to them. That means that we're being respectful of their privacy, making sure that we're keeping their records in a safe place. This also means that as far as when we are providing care to them, that we are letting them know what kind of care we're providing, when we're going to be providing it, when that care starts and when it finishes. It also gives them the chance to make sure that they have choice when they are getting their care. They can decide at any time they want to move on to another agency or another doctor or another hospital. These are the things that clients will always have a right to, regardless of their health condition or if or what state they are in, or if they are having care at home or in a facility. So when we are looking at our compliance program, we always want to make sure that our clients' rights are protected. So there's so much that goes into compliance that starts down at the employee and goes all the way up to the federal government. There's too much to list in a little short training that we have for the month. But the best thing to do is just to remember our original rule. If you have a doubt about something, then you just need to ask. Our number is always available to you so that you can ask those questions. And as we said before, you will not get in trouble for asking. What you do get in trouble for is not reporting. You have to report and you have to ask if you do feel like that there's some sort of wrongdoing going on that needs to be said or needs to stop. If you have any questions about this training, please call the office and let us know, or email us, and make sure that you take your quiz so that you can go ahead and finish out this training by the end of February. Lastly, there is a required compliance pledge that we mentioned you have to sign annually. To get credit for this quiz, you must sign the pledge and pass the training. If you have any questions about this, give us a call at the office.